You're sitting in traffic, late for an important meeting, watching the minutes tick away. Your hypothalamus, a tiny control tower in your brain, decides to send out order. Send in the stress hormones. These stress hormones are the same ones that trigger your body's fight or flight response. Your heart races, your breath quickens, and your muscles ready for action. This response was designed to protect your body in an emergency by preparing you to react quickly. But when the stress response keeps firing day after day, it could put your health at serious risk. Let's look into some serious things that can actually happen just by being stressed. Let's take the first one. Stress can actually cause headaches. Stress can trigger and intensify tension, headaches. Heartburn. Stress increases the production of stomach acid, which could lead to heartburn or make it worse. Rapid breathing. When you're stressed, the muscles that help you breathe tense up, which can leave you short of breath. Risk of heart attack. Over time, an increased heart rate and high blood pressure damage your arteries, which could lead to a heart attack. Pounding heart. Stress hormones make your heart pump faster so that blood can quickly reach your vital organs and limbs. Fertility problems. Stress interferes with the reproductive system in both men and women. It may make it harder to conceive. Erectile dysfunction. Your brain plays an important part in your process of getting an erection. Stress can interfere with this process. Missed periods. Fluctuating hormones can throw your menstrual cycle off, or in severe cases, stop it altogether. Tense muscles. Stress makes muscles tense up, and chronic stress can lead to tension-related headaches and backaches. A low sex drive. Stress and the fatigue that often comes with it can take a toll on your libido. Stomach ache. Stress affects your body's digestive system, which can lead to stomach aches, nausea, and other tummy trouble. High blood pressure. Stress hormones tighten blood vessels, which can raise your blood pressure. High blood sugar. Stress causes your liver to release extra sugar, glucose, into your bloodstream, which over time puts you at risk for type 2 diabetes. Weakened immune system. Long-term stress weakens your immune system's defense, leaving you more vulnerable to infection. Insomnia. Stress makes it harder to fall asleep and stay asleep, which can lead to insomnia. Increased depression. Chronic stress can wear you down emotionally and lead to depression. Now let's take an even deeper look. Stress is a natural physical and mental reaction to life experiences. Everyone expresses stress from time to time. Anything from everyday responsibilities like work and family to serious life events such as a new diagnosis, war, or the death of a loved one can trigger stress. For immediate, short-term situations, stress can be beneficial to your health. It can help you cope with potentially serious situations. Your body responds to stress by releasing hormones that increase your heart and breathing rates and your muscles to respond. Yet, if your stress response doesn't stop firing and these stress levels stay elevated far longer than is necessary for survival, it can take a toll on your health. Chronic stress can cause a variety of symptoms and affects your overall well-being. Symptoms of chronic stress include irritability, anxiety, depression, headaches, and insomnia. And let's take a closer look at this video.
Cramming for a test? Trying to get more done than you have time to do? Stress is a feeling we all experience when we are challenged or overwhelmed. But more than just an emotion, stress is a hardwired physical response that travels throughout your entire body. In the short term, stress can be advantageous, but when activated too often or too long, your primitive fight or flight stress response not only changes your brain, but also damages many of the other organs and cells throughout your body. Your adrenal gland releases the stress hormones cortisol, epinephrine, also known as adrenaline, and norepinephrine. As these hormones travel through your bloodstream, they easily reach your blood vessels and heart. Adrenaline causes your heart to beat faster and raises your blood pressure, over time causing hypertension. Cortisol can also cause the endothelium, or inner lining of blood vessels, to not function normally. Scientists now know that this is an early step in triggering the process of atherosclerosis, or cholesterol plaque buildup in your arteries. Together, these changes increase your chances of a heart attack or stroke. When your brain senses stress, it activates your autonomic nervous system. Through this network of nerve connections, your big brain communicates stress to your enteric or intestinal nervous system. Besides causing butterflies in your stomach, this brain-gut connection can disturb the natural rhythmic contractions that move food through your gut, leading to irritable bowel syndrome, and can increase your gut's sensitivity to acid, making you more likely to feel heartburn. Via the gut's nervous system, stress can also change the composition and function of your gut bacteria, which may affect your digestive and overall health. Speaking of digestion, does chronic stress affect your waistline? Well, yes. Cortisol can increase your appetite. It tells your body to replenish your energy stores with energy-dense foods and carbs, causing you to crave comfort foods. High levels of cortisol can also cause you to put on those extra calories as visceral or deep belly fat. This type of fat doesn't just make it harder to button your pants. It is an organ that actively releases hormones and immune system chemicals called cytokines that can increase your risk of developing chronic diseases, such as heart disease and insulin resistance. Meanwhile, stress hormones affect immune cells in a variety of ways. Initially, they help prepare to fight invaders and heal after injury, but chronic stress can dampen the function of some immune cells, make you more susceptible to infections, and slow the rate you heal. Want to live a long life? You may have to curb your chronic stress. That's because it has even been associated with shortened telomeres, the shoelace tip ends of chromosomes that measure a cell's age. Telomeres cap chromosomes to allow DNA to get copied every time a cell divides without damaging the cell's genetic code. And they shorten with each cell division. When telomeres become too short, a cell can no longer divide, and it dies. As if all that weren't enough, chronic stress has even more ways it can sabotage your health, including acne, hair loss, sexual dysfunction, headaches, muscle tension, difficulty concentrating, fatigue, and irritability. So, what does all this mean for you? Your life will always be filled with stressful situations, but what matters to your brain and entire body is how you respond to that stress. If you can view those situations as challenges you can control and master, rather than as threats that are insurmountable, you will perform better in the short run. and stay healthy in the long run.
This is something Vitamin Health Awareness wants you to think on. So when you take pain medication, for example, you might be like, I'm taking this pain medication. It's gonna stop the pain. So you swallow the pill and you assume that, it's actually stopping the pain. It's actually stopping the problem, when it's actually fooling the brain into thinking that the problem is solved when the problem still is there, and the body heals itself after doing it for so long. But if it's in a worsened state, the body won't heal itself, then you got to get stronger medication. And take a look at this video.
Say you swallow an ibuprofen tablet for a sore ankle. Within minutes, the tablet starts disintegrating in the acidic fluids of your stomach. The dissolved ibuprofen travels into the small intestine and then across the intestinal wall into a network of blood vessels. These blood vessels feed into a vein, which carries the blood and anything in it to the liver. The next step is to make it through the liver. As the blood and the drug molecules in it travel through liver blood vessels, enzymes attempt to react with the ibuprofen molecules to neutralize them. The damaged ibuprofen molecules, called metabolites, may no longer be effective as painkillers. At this stage, most of the ibuprofen makes it through the liver unscathed. It continues its journey out of the liver, through veins, into the body's circulatory system. Half an hour after you swallow the pill, some of the dose has already made it into the circulatory bloodstream. This blood loop travels through every limb and organ, including the heart, brain, kidneys, and back through the liver. When ibuprofen molecules encounter a location where the body's pain response is in full swing, they bind to specific target molecules that are part of that reaction. Painkillers like ibuprofen block the production of compounds that help the body transmit pain signals. As more drug molecules accumulate, the pain-canceling effect increases, reaching a maximum within about 1 or 2 hours. Then the body starts efficiently eliminating ibuprofen, with the blood dose decreasing by half every 2 hours on average.